Good evening, everyone, and welcome to Wellness Radio. This is Dr. Jeanette-Gallagher, and it's a pleasure to have you with us here this evening. Tonight we are going to be talking about the plight of the physicians these days, the doctors of all types of health professionals that are now finding that things are kind of in a push and pull kind of system. Have you gone to the doctor lately and you felt like a patient you were getting pushed or pulled, not being heard, things are going amiss? You kind of jumped in a chaotic situation. Perhaps when a physician goes to work, they feel the very same way within the systems that are regulating their control, that are telling them what they have to do, telling them how they should be, how they should dance and perform to all of these little checkoff lists. How can we exist in a healthcare system these days, providing care to the sickest of the many humans on this earth, and really trying to help them hold their hearts in our hands, hold their minds in our thoughts, and be able to say, we're here for you and we'll guide you through this and help you heal, help you live, help you survive, perhaps maybe even as I do, help you walk through to the end of your life, through the end of time, and be able to walk through that door. When there's so much chaos, pushing back and forth, what do? I think truly now we're at the precipice point in the year 2023. We're standing at the tip of this needle, and it's time to say no more. As a patient, as a doctor, healthcare providers, anybody in any system, the caring of the human being. Because now what we really have to say is, what can we do? How can we facilitate this process better? And how can we truly do the job that we were truly meant to be? And it's care for each other. Today, my guest is Dr. Pietro Garbelli. His book is The Doctor's Voice, Empowering Solutions to Physicians' Frustrations, Burnout, and Healthcare Inefficiencies. Dr. Pietro, I'm so glad to have you with us today. Thank you so much for joining us.
Thank you so much for inviting me.
I'm so glad to have you. Don't you think, Dr. Pietro, we sit down and we say, what's this push and pull? And we really feel like we're all being almost dismembered, don't you think, as patients and providers?
I think I agree. There is a lot of similarities in the experience of healthcare providers, whether they are doctors, nurses, or other healthcare professionals. It's difficult for patients to navigate a system that is very complex and fragmented and heavily regulated. So is it very much the same for us providers when we are caught between so many push and pull decisions made about us and the way we provide care, and where we rarely have any say into how it is done?
You know, I think also, too, Dr. Pietro, I think we see that there has been a breaking point, so to speak. You know, I grew up in the 50s. The doctor came to our house with his little bag. He gave me a shot of penicillin. I was good in a day. Mm-hmm. Life was better, you know. Or you would see your doctor in your local community, and they would know if you fell in the grocery store. And they knew how you fell. They saw your body move. They knew what they needed to do. They could help you there. Or when you came to the office, you would say, I saw you fall, and I can help you. And now we are so disconnected these days where patients are trying to provide the information. They don't have the right information that we need, but yet we're getting backed up on the other side, being poked by our electronic medical records saying, ask this question, do this, point this. And, you know, it's sort of like, you know, that old left brain, right brain thing. The patient's on one side of your brain and, you know, the system is on the other side, and they're pushing back and forth, don't you think?
Yeah. In an ideal world, we would like to all use both sides of our brains all the time to understand each other better, I believe. You bring me back in time. I grew up in the 70s, and my pediatrician went on and became my general practitioner, my family doctor throughout my life. And the continuity of care was different back then, but also the availability of time they had to look after me and other members of my family has completely changed. It's not just the fact that in primary care there is less continuity because of a different setup, but also the amount of time that each doctor has to spend with the patient has really shrunk to a minimum. And I have the privilege of practicing in secondary care in hospitals, and very often I hear a lot of bickering and prejudice, people judging what some other colleagues have done and thinking, oh, they didn't notice this simple thing. Why didn't they just examine the patient before sending them to the hospital? And I often have to remind them they simply don't have the time. The way the system has been set up does not allow them to do the same job that they might have done 20 years ago, or that we can still do in hospital in certain parts of the hospital.
Yes. Well, I think also, too, if you look at history, and I think it's very important to correlate history with medicine and the way humans have been evolving, is that in the 50s and 60s, your local doctor did almost everything, And then if you look at the 70s, started to branch out. You can go to a specialist. But there was only like one or two type of professions as a specialist. But then we got up into the 80s, and it was sort of like, well, now you can go to a heart specialist, but then you could go to a vascular specialist, but then you could go to another one for your blood, and we're going, but they're all working in the same thing. How can I do that? And then if we look at it in the 1990s, it got even more diverse. If the blood vessel in your toe was having a problem, you went to a podiatrist. If the blood vessel in your eye was having a problem, you went to an eye doctor. And you're going, holy crap, this isn't right. It's my blood vessels, doc. You're not listening. It's not my foot and my eyes. It's my blood vessels. And they would just be, doctors would be just like stuck. What do you do now? And you get stuck on that referral kind of loop, so to speak. Don't you think how medicine has really almost jumped off the edge, and they've really messed that system up in perhaps certain ways?
Yes, it has. I have experienced some of that, both as a patient, also as a carer for my mom and dad. But also I have practiced in different countries, and I noticed how the setup of the system makes a massive difference. For example, in Italy, where I originally trained, we have a similar setup where we get out of university, medical school, and we go straight into a specialty. So we inevitably absorb the knowledge from other people that have done a similar journey. We concentrate on a single organ or system, whereas in other countries where everybody is invited to spend more years into general medicine or surgery training before they specialize, there is a guaranteed minimum common denominator, a minimum level of understanding of how the whole body functions, and the ability to recognize and treat the most common illnesses without having to resort to a specialist. And that works so much better. I mean, I have observed that time and time again. And that was my journey. I went against the hyper-specialization type, and I chose to specialize first in internal medicine and then in acute internal medicine, just to be able to provide good care for my patients, regardless what organ or organs are affected by any illness at any time. But in many countries, that has become a rarity. Because
it's really
difficult.
If you think that, a blood clot in your heart is only to be going to a cardiologist and he's going to take care of it, he's just pushing it on out to go to be a stroke in your brain or to be a blood clot in your foot. I mean, the idea, I think, came about when the idea of the ICD-9 codes, those codes and the CPT codes, when you start having to code what you're doing, to get paid for it and to be able to refer, that's when things started to say, oh, I can't go outside of this box because I'm limited. And I think we will do the second half of the show today, Dr. Pietro, about solutions, but I think we need to state where it is first, is that doctors are now in a box and you are limited. There's no way about it. There's nothing else you can do about it right now. This is it. The answer is, can you do the best within that solution box to be able to see your patient? And I think sometimes what happens is that the patients are understanding of feeling your frustration, and they're trying to help you along saying, but let me tell you it's this, let me tell you it's that. You know, I had this one conversation with a patient, with a doctor, and the doctor was in his 30s or 40s, so to speak, and he was talking to me about my migraines that I've had, like, for decades, right? And he was going through the list and everything, and but it doesn't fit this qualification. You mustn't have migraines because you don't have A, B, C, D, and E. I said, let me tell you something. I said, you've been only in medicine for how many years? Like 8 or 9 years? I've been in this body for 60. So you know what? I'll tell you what I've got. And he just stopped. You know what I mean? Because I think sometimes the idea of what are you listening to, what are you hearing, and what are you able to facilitate? That's the process we really want. However, there's so many limitations in each of those parameters. That's where, in the year 2023, physicians are getting burnt out, patients are getting annoyed, systems are failing. Perhaps?
Yeah, you touched a lot of interesting topics. One is the hyper-specialization. One positive side of it is I always like to look at things from both sides, the good and the bad. It also allows very good training into techniques that require being able to do it all the time. So, for example, I'd rather have a bypass done by someone that does it every day rather than someone that does it 10 times a year, because their manual ability will be a lot better. And so I understand why we have created so many specialties in medicine. But one way to bring it all back together, for example, in hospitals, has been the movement of having someone that takes care of the global journey. So I guess you call them hospitalists in the U.S. So I think that's very interesting that we realized at some point we can't fragment everybody's journey and not having someone that brings back all the threads and connects the dots. The other thing that you mentioned is how we feel lost into the system as when someone tries to put us in a box. And that happens all the time in medicine, and I think it's a bit also down to training and experience. As doctors in universities, we are taught certain classifications and how to recognize symptoms and signs and laboratory values and give a diagnosis. And as the scientific knowledge and medical knowledge progresses, then the classifications keep changing, and there's a recognition after a while that what was considered made up by the patient is actually something that has a biological and scientific background. Think about all the DNA tests that now we can do, just swab our mouths and send off a sample, pay some dollars and get a result that tells us you're less likely to be doing well with that kind of medication. And we had whole generations of doctors that had been telling patients, "Oh no, it's not possible that you have that side effect. It must be your anxiety." Now we know there are certain inherited differences in how we process different medications, and each of us might react slightly differently. So I believe there's a future where maybe one day we'll be able to do this test a little bit more promptly, and be able to take seriously the individuality of patient journey without sounding too arrogant and say you don't fit in any box, therefore it must be something wrong with you.
Right.
Don't
you think, Dr.
Science
Pietro
will help us to be less arrogant in a nutshell.
Yes. Don't you think, Dr. Pietro, also too, I think that healthcare, patient care, awareness of our body, our education is truly a very fluid thing. If you look back again, going back to history, early 1900s, when the antibiotic came along, it was, you go to the doctor, no matter what you've got, he's got an antibiotic and he's going to fix you. You know what I mean? And if he can't fix you, then you were meant to die, kind of, so to speak. Now, you look at it several generations later, they say, oh, my doctor fixed me right up. He just gave me this and I was good to go. But now, if we look at it, medicine has changed so much. So I work a lot with elders, end of life, and the patients say, I go to the doctor. He's this little pipsqueak who knows nothing. I think I could teach him a whole lot if he would listen, and because their experience of the human body, of that which does not fit in a book, is very limited with many physicians. And I think sometimes we have dissed the patient in their elder years and saying, let me tell you how the journey has progressed. A person with heart disease can say, I can tell you how heart disease worked, what it feels like, what it doesn't feel like. I mean, for myself, I have varicose veins, and I know when it's blocked up in a certain spot and it can actually bubble and percolate and then move. And I said to the doctor one time, did you ever feel that? And they're going, oh, no, that's not possible. You can't feel that. You don't know what you're talking about. And I went, oh, bye-bye, because I think sometimes we invalidate the education of the physician and the education of the patient. If you look back in the early 1900s, patients gave up the power over their body. They walked into the doctor and said, Doc, fix me. Give me a piece of paper, it'll fix me. They gave up their power. But now, patients are saying, I want the power back to care for my body. I'm telling you the information. And the physicians are saying, oh, no, you gave up the power to us to save you. And now you want to be in a community with us and join us together? And they don't like it. Perhaps?
I guess you're describing a beautiful dance that we still haven't really learned how to dance on both sides. It's absolutely true. Medicine used to be very authoritative.
Yes.
Doctors were the people with the knowledge, and everybody was just shutting up and listening. And then we get to a point where we have seen over the last few decades popping up all the times when this approach goes wrong. And there's a whole new generation of doctors that have been educated in being more patient-centered. Whether they are able to do it or they're still struggling, I can't tell. I was one of the first generations where this was being heavily discussed and promoted in medical school, where we were invited to listen to the patient as the expert of their own journey, of their own symptoms. But at the same time, this clashes with the traditional medical education model where if it doesn't fit in a box or it hasn't been described, you don't know what to do with it. So sometimes it's down to lack of being going outside the box, thinking outside the box, using your knowledge of how the world, how the human body works, and apply it to that individual person. But I have to say, a lot comes also with experience. As we ourselves experience being patient and come up with some ailments, and experience also something that goes slightly out of the predictable journey for an illness or the type of help we receive, we become more open-minded and more able to listen to the patients in a different way. You might have noticed how some slightly older doctors might appear a bit more mellow and keen to listen to patients and crack a joke. I think a lot of that is down to experience. They are more able to empathize and understand that they don't know it all. They still need to figure it out together with the patient.
Yes. I think also, too, the idea of, I totally lost what I just wanted to say. So, okay, well, I'll go to the next one. I think also, too, Dr. Pietro, the first page of your book, it says, in your career as a doctor where you can no longer stand feeling unheard. I think the idea is that everyone is at a precipice point of needing to be heard. And the idea is what is the vested interest in being heard? Physicians, just as we say, you turn around, you have to always be up on the latest stuff. You have to do what's in the books. You have to do what's, quote, correct by the book so that you will not be liable for anything that happens, so to speak, in a human way. Patients put their hands and their body into the physician's hands to, quote, follow the book and be compliant so that they don't feel that, they made a mistake and they didn't take care of themselves. So this idea of validation of taking care of each other for maybe a different reason, because we don't want to make a mistake. How can we be held accountable? And, oh, my goodness, who's going to save me? I think those are three very viable principles that no one wants to touch the conversation. No one wants to be able to say, it's almost like that conversation is almost like, I don't hear you, and it's going on and on and on. But it is the overriding conversation that's driving the bus, don't you think?
I totally agree. For me, being heard is at the basis of any interaction. The interaction between doctor and patient, the interaction between employer and employee, interaction between healthcare providers and the healthcare authorities. At the moment, what I observe we are struggling with is dialogue, is information flowing both ways. There's a lot of dysfunctions that are, in my opinion, due to using models that are not ideal for healthcare. So some models they're borrowed by the corporate environment. Some others are borrowed by the military organization and so on, or by religious organizations, where there is a top-down approach, we tell you what you must do approach. And it's really difficult to be the receiving end of this and be able to speak up and be heard. We do try to speak up, but as you have experienced many times with your patients, sometimes it feels like nobody's listening, or you don't see a reaction to what you have said, written, documented. And that's where the idea of this book came about. After experiencing years and years of frustrations and feeling unable to change at all the rules of the game, even at a micro level, I thought, well, maybe it's time to start a conversation at a bigger level, at a macro level, macroscopic level, in each country, in each hospital, in each healthcare authority, because if we never do, as you mentioned, where is the bus going? Who's driving? Where are we ending up?
Yeah. But you know what I also, too, think is that when you look at it, it's all about what is the truth and what is reality. Because when you say, we have to follow the rules, then we have to follow the rules, because if we ever drop even outside of the box or even think about sticking our foot outside of the bus, so to speak, that's when you get cut off. You'll either be kicked out of the hospital, you'll lose your license, you'll be dogged down in social media like nobody's business. You're, quote, you're not the good doctor, you're not the perfect doctor. You didn't, quote, follow the rules, so to speak. So there's always this push of shoving. It's almost like when you get up and you put on your scrubs. I don't know about you, but I always felt this way. When you put your scrubs, it's almost like you're a robot and you're donning your apparatus for today. Do you know what I mean?
Mm-hmm.
And
yeah.
your mind is not even engaged at all. You're just going through the motions for each day based upon the Rolodex, which is your education and your training, that keeps spinning in your head. I know so many times, I have seen it, with emergency room physicians, they're like, that patient could have been saved if you did A, B, and C, but you didn't. That patient, you missed this. It was this, but you went around A, B, C, and D. And always the answer would be protocol. This is protocol. This is the way it is. This is protocol. So here's the question, Dr. Pietro. Can we ever exit the bus, or do we just keep getting cut off and stay inside for safety reasons? I mean, we see doctors leaving private practice to go underneath the hospital because of the tort laws, the insurance. They need more protection, under a hospital system that will, quote, be their tribe, so to speak. So are physicians reverting and going back and sticking with the tribe instead of standing up and saying, we've got to make a change, and how can we do it?
Well, yeah, that's exactly what I'm set up to do, make a change. And personally, I always struggled, like yourself, being a part of a system where very often you feel the pressure to conform to what everybody else is doing. Sometimes protocols are good and useful to give you a framework to organize your thoughts and your ideas, to understand the priorities, and very useful ones when there's a cardiac arrest. It's good that everybody knows what we're doing and we do it in a certain organized way. Otherwise, there's complete chaos. But for everything else, when there is no emergency and you have time in your hands, we notice that even the best written guidelines and protocols have limitations. And simply because the science they're based on are taking one thing at a time, very often, doing research, scientific research, is very artificial. You need to find and select patients at the origin and have people with just one problem that take only a certain predefined number of medications so that you eliminate all interference. And in real life, people are much more complex than that. They have multiple diseases. They take a bunch of medications all together that can interact with each other. So the way we practice medicine needs to be based on that, on clinical experience and knowledge and understanding of how drugs work, how the human physiology works, and be able to navigate that complex system. It can never be reduced to one algorithm, one flow chart. And then there's the behavior part as well. I very often teach my medical students and junior doctors, forget for a moment about the protocol. Let's use our our understanding, our brains understand what's going on for this patient, and then we can talk about the protocol and why there's something missing in the protocol. Whoever wrote it didn't wasn't able to think about all the possible scenarios. It's far too complex. And then when it comes to being ourselves and being authentic, I always notice how people warm up to being odd, being ourselves, although you might have a behavior that does not conform, does not fulfill the guidelines and the expectations, and that's why I challenge those guidelines. When there are regulators that write to the minimum detail, that's what we expect of the doctor's behavior, I very often think, well, good luck finding one, because we're all human and we all have lives and emotions and thoughts and opinions, and you can't impose every single aspect of behavior on someone. I think the ancient oaths for doctors were much more down to the core of what's important to expect from a doctor. Do not harm, relieve pain, help people in the last days of their lives, educate other generations of doctors. Simple things, but very important ones. And do not break the law. Very simple things, but sometimes we get heavily scrutinized nowadays on very petty things like what somebody has posted online, whether they liked or retweeted something that somebody else has posted. I mean, how much more interference are we going to accept on our personal lives before we say there's something off?
Yes. You know, I think also, too, Dr. Pietro, is that I think over the decades it has always been, people would say, I am a diabetic, and they would own it as their persona. And I would always say, oh, hi, Jane. No, Jane, you have diabetes, and how would you like for me to help you navigate the path? That's what we're asking. Change the verbiage. You don't own the disease. You don't own all of the issues and all the problems. You are a human being navigating a disease parameter experience that your body has taken on for today. And I think if we can look at that, sometimes it seems to clear up a lot of confusion in some people's heads. You know, like, you know, maybe in a naturopathic physician, people come to me and they'll say, well, I have cancer. You're my last resort. I've gone to all of these other doctors. I need you to save me. And I would just say to them, oh, awesome. I'm so glad you're here. What would you like to do for the next day of your life? And they're going, what? And they see, so it was very diverse because they were not understanding that you're not that disease that we have to save you from. That disease is the process you're within. You know, and that's so different. Even with end of life, you know, patients would come and they'd be scrambling, save them, save them, save them. And I would say, they're in that end of life disease process. Allow their body the honor to be able to just leave and separate from their soul respectfully. And they're like, no, we can't do this. We can't do it that way. And so I think sometimes, just as you being in another country and being in Europe, Dr. Pietro, I think the idea of Buddha, of God, of respect, of religion, of belief source energy, of quantum physics, all of these other things, I talk with my patients all the time because there's something so much more value in our soul and our spirit, and we look at the body and we say, but that is the me. That isn't you. That's your physical body you jumped into. There's so much more about you. Even if you're like, you know, I'm sure you've seen it. You know, patients at end of life, they're like, oh, I did this and that. I said, honey, that's not you. When you leave your body, all of that legacy story is going to be pushed out in the street for the garbage man to come by to take it. Don't worry about it. all you have to worry about is today, how you're breathing today. So might we, as physicians, as doctors, as patients, start to realize we're more than saving or perfecting the human physical form and learn how to navigate through our processes, perhaps?
Yeah. You made me realize that the same attention to language applies also to ourselves as professionals. We very often base our identity on saying, I'm a doctor or I'm a nurse, as if that is a part for the whole, that's all your life. And that creates expectations. It creates an identity that is very anchored on your function as a physical healer, but forgetting sometimes that you're also so many other things. You're a son or a daughter, you're a mother or a father, or a cousin, a spouse, you're a healer and a destroyer. You're so many more things, and it's reductive to see any of our lives in such a narrow way. And you mentioned how the importance of spirituality, which is something that has started to show up in the medical paradigm, but maybe it's not mainstream yet. I think in mainstream medicine we are just about starting to say, well, everyone has got a support system and a religion and their own version of spirituality, and it's important for us to respect it. So be sensible when you talk to them. But then there is so much more when we start to explore what spirituality really means and how it applies in ourselves, how it affects our human journey, then we can easily understand that that's also a tool that we can use and tap into to support people in their experience of disease and healing, and that we very often forget or try to contradict and minimize and blame. We might make someone feel rejected and shameful because of the other tools that they are reaching out to besides medicine. And I think it's very important that we talk openly about that. I've been myself experiencing lots of these aspects and supporting some patients in, bring their own crystals or a healer friend in the hospital. Why not?
Yeah, so many times, I will work with patients and they will say, I'll be going into the hospital room and they'll be dragging me and they'll be saying, she's talking to somebody over there in the corner. And then we have to go get the doctor so we can medicate her down. I said, no, honey, she's just talking to the angels that are here to welcome her home. And all of a sudden people just freeze and they would go, okay. We don't need to drug this person down. We don't need to stop their breathing so they can go or whatever because of our discomfort. So I think sometimes we have to realize that as professionals and as patients in this whole entire paradigm is that just because someone else has a different perspective, because it is unknown to us, makes us feel uncomfortable or we do feel like we're the experts in it, we should diss it. For myself, who is your healthcare team? You should say to the patient right off, hey, who do you have on your team? How can I help support your team? Can I speak to your team? Can you share something with your team? Can you maybe share some notes from your team? If patients are told to form their own teams, maybe then I think we would say that we don't have to feel like we're going to make a mistake and lose someone because the human body was meant to be lost anyway. Who are we to say it should stay around for 65 or 100 years, So in other words, stopping the saviors at all costs and say, who is the team to help you navigate your life? Isn't that all the patients are asking? And isn't that perhaps what we maybe need to reflect every day in how we are engaging in this process?
There is also something to say about the way we in mainstream medicine don't have a framework yet to understand and navigate experiences that are out of the ordinary. And perhaps it's also due to our own experience being a little bit at the extremes of the spectrum. For example, when we approach someone in the ER that is really aggressive and is trying to do something violent because they hear voices, it's difficult to consider that is a positive experience of someone that might be having extrasensorial perception.
Correct.
It's not your experience of someone that is having a completely peaceful experience and just enjoying some other kind of extrasensorial perception. So I think it's in that context, the way psychiatry classifies everything under certain categories of illnesses does not allow us to see a spectrum, does not allow us to see a continuum and different hues and different interpretations of something that is part of the human experience. And we can't deny that some people are genuinely suffering from mental health problems that are interfering with their life. It's really difficult sometimes, I have observed, even for highly intuitive people, to understand what someone else is going through. Is that a positive experience? Are they having just an awakening, or is that a sign of mental illness? I think none of us has a magic wand that is the only way to discriminate between the two.
Correct.
I haven't come across that. I don't know about your experience.
Well, you just described me to a T, Dr. Pietro, because that's how I see the world. I always look at it as medicine really has to conform within the standard deviation. And everything outside of it, those outliers, we're trying to shove everybody into it. Because if you look at it, even like with psychiatry, if you have horrible anger and you're over on the left, they got to try to push you to the middle to, quote, calm you and keep you in that space. But if you have too much joy, if you're over exuberant, you got a problem too. We're going to shove you back in the middle because you shouldn't be that joyous all the time. Right, correct. So the idea is that, I've seen ghosts and angels my entire life. It has always been that way. I've always said I could go into a mental hospital and probably clear out half of the people because there's nothing wrong with them. Yes, they're having a soul awakening. They just haven't found the person to help them navigate the process.
Yeah. Period.
So going back to the same thing, who are you going to find to be part of your team to help you navigate the process? So I think perhaps as healthcare in its standard form implodes, we're going to have to rebuild it, I think, perhaps maybe in the next decade, into teams of people that are open and saying, hey, I don't understand that, but I would love for you to be able to support my patient and help them navigate. Could you do that? Wow, how eye-opening that might be. You know what I mean? Yeah. To be able to say that. And I mean, for myself, it was sort of like I'd gone to the hospitals here in the U.S. many times. I wanted to just be that person that would shadow and say, I felt this is that person. Oh, perhaps maybe I can help that. Oh, I'll just sit with this patient, just hold them. And they may not need that drug of morphine to be able to do that. I even know with my own son, who tried to commit suicide 13 times. On the last one, I said, hey, you go. He was in another state. I said, you get your counselor, go in a white room and call in fear. And I want you to sit there until you reckon yourself with it. how big is it? What is it about? And he says, oh, it was just in my mind. It really didn't have power. I said, yeah, okay. Now you have something to work with. So I think, can we break down our old definitions and defining statements and say, we as a collective, we as humanity, we now in the society, we now in the world in this decade, can we be the leaders and make the choices and the changes that are really out there?
You bring up a lot of really relevant topics, and I like the word collective that you use to describe the fact that this is not an answer that relies with one individual. And some of the new models of healthcare that I have come across over the last few years that I believe are promising for the future of healthcare are exactly supporting this multidisciplinary approach. For example, the functional medicine model or integrated healthcare model, holistic. There's so many different ways to call it, but recognizing that it takes a whole village to heal a person. It's not just the job of one person with particular technical skills. You also have to support them in their understanding why the illness has occurred. So that might be looking at lifestyle, looking at life issues, looking at nutrition, and then support them in their healing journey with their movement, physiotherapy, occupational therapy, getting back into being productive and in contact with other people, and having a healthy spirituality. All of that matters, having a purpose. And sometimes we want to identify the one single point of intervention, be it a practical thing done to the body or a chemical compound that we can give as the responsible thing for this healing, when in reality all of us have experienced that that is contributing. It might be a major contributing factor, but then the body does the majority of the healing. And we heal ourselves, and the people around us support the process. We cannot forget about all of that and say, it was just that drug that I took for 2 days that switched everything. It might have been a life-saving drug in that moment, but how about all the rest?
Yes. You know, in closing, Dr. Pietro, my vision of what I've always seen, I'm almost 70 now, I've always seen this vision and I've always believed in it, is that there would be doctors and they would not be in big groups. There would be a doctor, and he would have a local area that would be his terrain, so to speak. And there'd be, like, different practitioners or healers or whatever in it. And everybody would join together to support each other. You know, like if someone didn't have something to eat, I know for myself, I made a big pot of sauce the other day. And, you know, my husband says, oh, I don't want it. And it's like, okay, fine. So I took a bowl to my next door neighbor. I took one to the other neighbor, and I said, did you eat today? They said, no. I said, here's your dinner. So I think if we try to support each other, in no matter how it could be, to be able to keep them here in this earth, to help them, support them to live in life and be happy, that's really what it's all about. So if a doctor saw someone fall in the grocery store, he wouldn't be running away from them because, you know, he'd wait for the lawyer to be able to pick them up or whatever, you know, a kind of idea, you know. Instead, he might say, how can we help them? Can we all support each other? Instead of being afraid of being chastised or being wrong, can we say that there's a lot of wrong out there, but let's start to be the good people. Let's try to find the goodness in people. You know, where someone does something wrong, we say, awesome, I'm glad you had that experience. What did you learn from it? So that I can see it next time when it might show up at my door. And you're kind of diffusing the negativity out of the world around us. And if you can diffuse the negativity out of people, out of society, maybe it will then diffuse out of healthcare. Because let me tell you, there's a whole lot into healthcare negativity. We know it every day when we open up the door to the hospital or the office. We hear it every day, you know. So, I mean, the idea is, can we allow ourselves to be the positivity in the world and help see the negativity and diffuse it? Can we do that?
I believe there is a lot of room for that also in healthcare organizations, how we can support each other and be supportive, compassionate, and understanding, and how can we cross the boundaries, for example, between different professions and different grades of a hierarchy and different traditions. There's a lot of people in these small or huge villages called hospitals that very often spend the whole existence working side to side and very rarely exchanging ideas or trying to understand what each other is doing and trying to be supportive and see what in whichever way or form. There's a lot that can be applied in. I very often see if you look at the amount of time each of us spends in a hospital, we very often see our colleagues way more than we see any of our family members, and why does it feel so dry and artificial and non-supportive? It can for sure be changed. It's in our power.
Yes, absolutely. You know, I think also, too, the idea is that to understand that everyone is human, the job, the profession, your disease, or whatever it is just a badge that you wear on this human wetsuit. You know, that's only the experiences or the education you're going through. It is not who you are. If we could ever see everybody for just as a human being, truly, I mean, that would be life-changing. I mean, how many times have you heard, oh, well, my cardiologist, he turned around and had a heart attack. I'm not going back to him because if he can't save himself, then how can he save me? Oh, my goodness, haven't we heard that? Right? And it's sort of like, did you forget that's his profession? It's not his human, right?
Yeah, and there is sometimes an expectation of having complete control over things, over our own physical experience, and there are limitations, and it's not just the technology or the ability as a human to figure it all out, but it's also maybe it's not where things are meant to be. Maybe we don't understand fully what's really going on. We don't have the technology yet, and from a spiritual point of view, we never will, because we can't expect to have control on things that are outside of our bodies. We probably can control our minds to a certain extent. We can control what we think. We can control how we react to things that happen to us, but that's pretty much it, I believe.
Yes. Dr. Pietro, I think that as you progress in your life, and, you know, I wish that in mine, perhaps maybe we can just be the voice, as we say, the doctor's voice. We can be the voice of being able to say there are other ways. Can we create a different tribe? So I thank you so much for joining us today, because what we've done today is we've truly kind of thrown out some nuggets that said this is the way it is, and we said it doesn't have to be that way. Maybe it could be this way, or how about this? And we also stuck our leg out off of that bus and said, hey, I'm going to take a leap. So what we need is more people to take a leap. So we thank you so much for joining us and taking that leap today.
Thank you so much for having me and for spreading the voice and starting more interesting and meaningful conversations around the world.
Well, thank you so much, Doctor. Can you share with us how to find out more information about your work and your book? That would be wonderful.
Yes, you can find more about me on my website. It's dr-garbelli.com, and I'm on all social media as at dr-garbelli.
Well, it was such a pleasure to have you. I think so many times we say, I don't really know how to make change, but I think this book is wonderful for physicians, but it's also for the patients to understand and be able to join in, because we can't do it ourselves. It's going to be, as we said, the collective. So thank you so much for joining us today. It was truly a wonderful time to speak with you.
My pleasure. Thank you so much.
If you'd like to find out more information about Dr. Pietro Garbelli, again, the book is The Doctor's Voice. Please do click on the link on the bottom of today's show page for more information to go directly to his website. And it truly is about being able to say, we are not the victims. We don't always have control. We are all in this together, and everybody is experiencing something different at each moment in time. How can we honor, respect, care for, and just love each other and be able to say, I will guide you, I will walk with you, and I will help navigate you to the end of your days. That's all everyone's asking. Thank you so much for joining us today. This is Dr. Jeanette-Gallagher, and until tomorrow, have a great day.